Good morning, students. So, I hope you have all done your INI-CET well and rested and recovered from it and are preparing for your NEET-PG 2025. So, during your preparation, it is also important to know that the previous questions might be asked in a different way. So, it is always important to learn from our mistakes. So, this is just a session for recalling of questions from psychiatry asked in INI-CET May 2025. And there has been like 7 to 8 questions from psychiatry, which is very higher compared to last year, where very few questions were asked. Sometime in one exam, only one question was asked. So it's good that there is a lot of questions. Let's just discuss it. Some questions are controversial. These questions answers are based on the standard textbooks. So if you have any doubts regarding it, you can definitely reach out to me. So the first question was taken directly from one of the UG textbooks of psychiatry, Neeraj Ahuja. Right, Lord Hanuman is celibate. I am celibate. So I am Lord Hanuman. What is the psychopathology described in this case of schizophrenia? So they've already given the diagnosis also. So what we should know is this looks different. So it could be some sort of thought disorder or something like that. It is associated with schizophrenia. So if you directly know the answer, that is fine, but still we can definitely rule out the options and get the answer well. Right. So is it neologism? Celibate is not a new word. Celibate means abstinence from sex. So celibate means somebody who is not involved in any sexual activities and they are voluntarily abstaining from it, right? So that's not a new word. So it is not neologism. Viperidine is seen in gangster syndromes, called as Ganser syndrome, seen in prisoners and gangsters. Here that was not given and it is not an approximate answer per se. So it is just a statement. So this might not be the answer. Loosening of association, we know it is a formal thought disorder. Loosening of association means the link between each words will not be there. The association between words will not be there. Because of that, the sentence will not make sense. But if you look at it, Lord Hanuman is celibate. I am celibate. So I am Lord Hanuman. Actually, the association between words is pretty good. So this is not the answer. So the better option would be autistic thinking. So we have discussed this in our workbook in schizophrenia, the 4 A's of schizophrenia given by Eugene Bleuler: association loosening, affective flattening, autism and ambivalence. Autistic thinking means a fantasy thinking where the patient is engrossed in their own world and makes assumptions on their own. So this is assumptions on their own, right? So this is autistic thinking. Loosening of association, viperidine, everything we had discussed during our class in thought disorders, right? So the answer is autistic thinking. The question might look difficult, but it is actually an easy question. Now going to the next question. Which of the following drugs are used in the management of acute mania? Again, very simple question, but asked in a little, to make you confused, right? It's actually a very simple question. So if you look at it, it was given as multiple option questions. So they had given 4 options and then they had asked if it is a combination of options. So if you look, lithium, can it be used in the treatment of acute mania? Yes, it is a mood stabilizer. It can be used. Valproate, yes, can be used. Haloperidol is an antipsychotic, and like we had discussed during our class, patients with acute mania require certain antipsychotics and sedatives during their acute phase, right? So the question asked is acute. So when we discussed it, see, treatment of acute mania requires antipsychotics, requires lithium, requires sodium valproate, sedatives. Yes, so here first 3, yes, these are also required. Amitriptyline is a TCA, tricyclic antidepressant, which is an antidepressant. So not just in acute mania, any patient, even with depressive symptoms, if they have a history of bipolar affective disorder, we have to definitely avoid an antidepressant. That's what we studied, right? So this is not the option. So the answer would be 1, 2, and 3. Simple, right? Now going into the next question. So the third question, choose the incorrect statement. Opioid overdose is fatal. Is it fatal? Yes. So opioid overdose causes respiratory depression, pinpoint pupil and coma. So it can be fatal. Coma is fatal. So this is a correct statement. Hence, this is not the answer. Buprenorphine can be used in the management of opioid withdrawal. Yes. So, in the opioid withdrawal management, we use buprenorphine both for detoxification and for opioid substitution therapy. So, yes, buprenorphine can be used for the management of opioid withdrawal. So, this is also a correct statement. Hence, this is not the answer. Right. So, flumazenil is used in the long-term management of alcohol dependence syndrome. No, flumazenil is used for benzodiazepine abuse or benzodiazepine poisoning to reverse. It's an antidote there. Hence, this is the correct answer. Cannabis withdrawal is not associated with physical symptoms. Yes. So, cannabis, unlike other opioids and alcohol and other drugs, it does not have any physical symptoms on its withdrawal. Right. So, the answer is flumazenil is used in the long-term management of alcohol dependence syndrome, which is the incorrect statement. Did we study flumazenil? Yes, for benzodiazepine overdose, we did study flumazenil during our discussions. Now coming to the next question, again choose the incorrect statement. So alcohol in low doses causes brain stimulation and in higher doses causes brain suppression. So this is a slightly controversial question. A lot of people have other answers. But I know I have referred all the textbooks. There is no direct statement taken from the textbook. But alcohol, what happens? Alcohol is a CNS depressant. So it acts on the depressive neurotransmitters, depressive receptors like GABA, etc. Right? So you have your cortex. In cortex, from the cortex, there is a lot of inhibition on the amygdala and the other lower brain areas. Right. So alcohol, when it starts getting affected, when it's in the low doses, it blocks the inhibition of the cortical receptors. So inhibition is blocked. So when inhibition is blocked, there is disinhibition. This inhibition causes stimulation. Right? So, in lower doses, it can cause brain stimulation. There is a possibility it causes. So, this is what is described even in some cases of paradoxical excitation. That is when you give some CNS depressants like benzodiazepines or barbiturates in patients with low brain reserve, it causes paradoxical excitation. So instead of depressing, it causes excitement. This is because of this disinhibition. So in alcohol in low doses, when it starts affecting the receptors, it causes stimulation. Yes. In higher doses, all receptors, even these receptors are also blocked. Hence, it causes brain suppression. So this is a possible correct. This statement can be considered as correct, which is the controversial thing, right? A lot of people think that since alcohol is a CNS depressant, this cannot be a correct statement. So they believe that brain stimulation and behavioral stimulation are different, but it can be considered the same also. Right? Cannabis causes self-driven repetitive behaviors. So cannabis can cause drug-seeking behaviors, but they are not generally repetitive in nature. So repetitive behaviors are very commonly seen with opioid abusers. When you compare with cannabis with opioid has higher repetitive behaviors and some obsessive compulsive behaviors as well. Whereas cannabis, generally as a recreational drug, that is not associated much with repetitive behaviors. Yes, drug-seeking behaviors can be there, but repetitive behaviors are a little less when compared to opioids. So this could be the incorrect statement. Opioids are effective analgesics. Yes, we know, we use it for anesthesia, analgesia, etc. Volatile inhalations are toxic. Yes, we know. So the better answer would be cannabis causes self-driven repetitive behaviors. Right. So this is slightly controversial. We do not know what the correct answer is unless the board decides. And we do not even know if this is the correct exact question asked. It is based on recalls. So based on my understanding and reference from all the textbooks, this seems to be the better answer. Now coming to the next question. Which of the following is not not a diagnostic criteria for depression according to ICD-10. So diagnostic criteria for depression we had discussed with the mnemonic siege caps. Right. So let us see. Loss of interest. Yes, loss of interest is present. Hence, this is not the answer. Low mood for major part of the day. Yes, sad mood is present. Hence, that is not the answer. Low energy levels. Yes, decreased energy or easy fatigability is present. Hence, that is not the answer. So, obviously, the answer is low self-esteem and low confidence, which is usually not in the diagnostic criteria for depression, and it is not seen in depression per se also. This is part of personality sometimes, right, and the overall well-being of a person. In depression, it is low energy level and decreased concentration, right? So, according to ICD-10 diagnostic criteria, it is not present. So this diagnostic criteria is from DSM, but ICD-10 also has the similar criteria. Hence, this is the answer. Which of the following is a new psychoactive agent used in rapid management of depression? So new is the keyword here and rapid management is the keyword here. Mephedrone, no. It is an opioid related drug. It is not associated with depression management. Amitriptyline is a very old antidepressant. So this is not the answer. Ketamine and cannabinoids. Ketamine is FDA approved for depression and it has rapid onset of action. So this has been an expected question because it was a newly approved drug. So it is available as nasal spray in Western countries, not yet in India, and as IV preparation. Right. So this can be used for depression management and this is the correct answer. We had discussed esketamine nasal spray as a newer agent for depression. Which of the following drugs should be avoided in a BPAD woman planning for pregnancy owing to risk of neural tube defects? So a question cannot be easier than this, right? So I've already told you BPAD is a very high yielding area for questions. They ask questions left, right. Even in today's paper, there was acute mania treatment asked, and drugs medications are a very high yield area of questions, and pregnancy is also a high yield area of questions. So three high yield areas together is asked in this question, but this is a very straightforward question. Anybody who is even starting preparation can answer this question. Neural tube defects are always associated with valproate, and in BPAD, so this woman has to avoid valproate, right? Right, we had discussed it. Neural tube defects caused by sodium valproate. A patient is awake and close the eyes. When they open the eye, which of the following EEG waves is reduced? So this is also again a very, I told you EEG waves are very high yield area, because if they want to ask an image based question in psychiatry, EEG is one of the important areas that they can tap into. But this was not an image based question, but still EEG has been asked. So we have studied delta, theta, alpha and beta. So when patient is awake and eyes are open, we have beta waves. And when the patient closes the eyes, we have alpha waves. What is the question? Once they open the eye, what wave is reduced? That is the question. So when the eyes are open, there is beta waves, and eyes are closed, there is alpha waves. Right? When they open the eyes, alpha wave will go down and beta wave will increase. So the question is, what is reduced? So answer is alpha waves. Right? This is pretty simple, but they have asked in a twisted way. Right? So you just have to know your basics well enough to understand all of these answers. Right? I'm sure you might have gotten almost all of these questions correct. If you have gotten one or two wrong, please correct it during your NEET-PG preparation. Revision is the key. Good luck. Prepare well. All the best.